The flesh is weak.
It's very weak. And it is high time now that we must accept that there is really no free lunch
anywhere.
And there is going to be paid for. And the government must find a way of paying for it. Those who are in the southwest, who are not controlled by the SCN,
yes.
All right, they have no choice because they inherited that free thing from their predecessors in parties, Action Group, SDP, everything. But the reality in the world now, as you can see, that even in Europe where they have economic, what will I call it, downturn,
yes.
They're cutting down on health. I train in England, and what is happening to health in England now is an eyesore. It's very, very sad.
The NHS?
Yes, NHS gone down, and conservative government does not care. I'm happy that Cameron is being taken up by his financial advisors, that he is not telling the country the truth about the situation. Right? They have gone on health, cutting down on health, the austerity. Greece, the doctors came out in white coat to protest about the cuts in the health services in Greece. Don't talk of Spain, don't talk of Portugal. It's worse.
But the situation we have back home is different from
yes,
this. We don't even have anything.
We have not even got there. We have not got to a point where we can cut down. That's the difference. They have got to a point that cutting down, it's an agony for them, but they are cutting down. We have not got to that point at all. That's why we must go. Government is voting in Lagos State 7% of the total budget for health, which is higher than even the federal, which was about 5.7. It is even higher this year, but let me praise them. Federal government has given a higher vote than last year, but it is nothing to compare with South Africa, Zimbabwe, Tanzania, those countries. Don't let them tell us they are small countries. It doesn't matter. The bigger they are, the bigger the problem, you must solve it. That's why you are in government. 15% is what WHO recommends. It's not sufficient, but that's what they recommend. And we have not made that. Why can't we make it? Why can't we make it?
There's a caveat here. If WHO recommends 15%, but again, that cannot work in this environment. I will also use Lagos State as an example too, because these are things we have addressed. We are trying to address. The budget is there. We've tried consistency to increase that budget, albeit not for every year. But the fact is that what we are budgeting for here will be 7.8% right now.
Yes.
But there are other aspects of governance that we're spending so money on. It may not be health, directly health, but indirectly the impact on health. We're spending money on environment, issue of sanitation, sewage, spending money on water, road transportation, education. All these things have positive impact on health. If you can address this thing, there will be tendency for people to go to hospitals. So if you look at it globally, we're spending much more than that on the health sector. That's what I'm saying. But again, like you did say, the population of people we need to deal with, we've addressed it, we have limitation of resources. And that's why we are looking to this issue of health insurance scheme thing. It's a scheme that we need to use to address that, provide that financial protection for the poor. But again, how to organize it, how to put it together is working on the framework. We're almost at it. As of now, we are doing 3 pilot programs in 3 different parts of Lagos. One of them is working perfectly well. It's more like a community-based scheme thing. And in that too, we're trying to infuse this issue of maternal and child mortality, because it's a major issue to us here. So very soon we'll come up with a proper framework that we're going to scale up in Lagos State.
Also, another thing that contributes to maternal mortality is the attitude of the workers in the hospital.
Yeah.
There's something in today's paper about a man who, I think he's telling a story in about a full page or 2 pages about his wife in a hospital, which shall remain nameless, and it says he was telling the nurses to help his wife, but they ignored him until his wife died, and she was there trying to have a baby. So the attitude of workers. I have heard nurses screaming at women, why are you shouting now when you were doing it and you were enjoying it? The women are in dire straits and they need help. And all you can do is make a joke of it and ignore them until some of them actually pass on.
I agree with you. And that's a part of our program too. When we say we're going to sensitize the community, we also sensitize the health workforce. Because to address the issue of this attitude. And it's also related to the quality of care you provide. Because if people come to you, they are not satisfied with your service, then your quality is poor, no matter the number of gadgets you have. So I do agree with you. There are quite a number of things. You cannot change attitude overnight. And you have to address the cause of that attitude.
Okay.
And I will not give reasons, but again, it's something we need to address. We've got to address it.
Okay, final word from Dr. Falomo. We have to wrap up now, sir. What will be the strongest message in one or two sentences that you give to Nigerians in terms of taking care of their children and their women and pregnant women that would really be of help? On the one hand, and on the other hand, another one sentence for government, what they should be doing to help reduce mortality.
All right. First and foremost, I should tell the Nigerian people to pull down on their women having children. They must, because of our situation here. It's a poor country, if you want to put it that way. Maybe not in resources, but poor.
They won't agree with you.
They won't agree with us. Okay. Then if they have to have, they must also get to the health situations, health facility that is already available as quickly as possible. Right? They must also know the limitations we have in power, in water, and everything, and they must take that into consideration. Right? I'm going to come to the government. But we must know ourselves what we have and don't push it to a limit whereby, it will be too late to help them. However, the whole thing lies with the government. I agree with the Commissioner for Health who said we have to do every other thing. If the world believes that we must give preference to mother and child in the next millennium, we must do so in Nigeria. We cannot be an odd man out. And the first thing is for the government to agree to this thing that we are going to do it. The target of 15% may not be possible up to 2015. Let us try and see, apart from the insurance something, maybe you can involve the private sector, which I belong to, and have some health trust fund. I've heard this thing being bandied around by some people to assist the government. Government can't do everything alone. Fine. Then encourage the private sectors to also come in, so that at least what the citizens get in return will be something much better than the limited budget we're having now.
All right.
That's my advice.
Okay.
Well, thank you very much. This is a topic that we have to keep looking at because the issue of maternal mortality is serious indeed. Otherwise, our population, we would just all die off. There are no women able to have children dying at childbirth and the babies dying at childbirth. That would be the end of humanity. So we have to keep talking about this issue. Thank you very much for coming, Dr. Jide Idris, Lagos State Commissioner for Health, and Dr. Falomo. Thank you very much for coming and spending this time out with us this morning. Sunrise will be right back with yet another interesting topic. Please stay with us.
Not another luxury. The new luxury comes into the world. Experience new luxury. Kia Quaris.